Imagine you're sitting there in a sterile little exam room, just staring at a medical chart on your phone.
Yeah, or maybe you're reading your own pathology report.
Right. Or perhaps you're just, scrolling through a news headline about the latest global health crisis, and you see these massive, complex Latin Greek terms just staring back at you.
It can be pretty intimidating.
Totally. And because it's medicine, you probably assume that these words are as exact as mathematics. Like engineering.
Exactly.
Break your arm, the x-ray shows that jagged white line, and the doctor just points and says, there it is, broken.
Right, and it's a very comforting assumption. I mean, we want medical language to be binary, a cold, hard equation that leaves no room for doubt.
Mm.
But the reality of how these words are actually built and applied is incredibly messy.
Which is wild because you see a word with a specific prefix attached to it and you think it represents an indisputable fact. But today's deep dive is going to completely flip that idea on its head.
It really is.
We are unpacking 3 high-yield medical prefixes that you see everywhere. Neo meaning new, pan meaning all, and semi meaning half.
And, the central irony of this deep dive is what makes these sources so fascinating. These prefixes sound like the ultimate quantifiers.
Right, like they promise total mathematical precision.
Exactly. But when you look closely at the history and the clinical application, they are actually battlegrounds of human judgment. Committees argue over them. Fortunes are made and lost over them.
Wow.
Yeah. Surgical plans completely change based on them.
Okay, let's unpack this, because how we got these words in the first place sets up this whole illusion of precision. And that really comes into focus when we look at our first prefix, pan.
Yeah, so we'll start with the grandest claim of them all, pan. It comes from the Greek pas or pan, meaning totality.
Like
Every instance, every organ, every population, no exceptions. But if a medical condition claims to encompass everything, it forces us to ask a really difficult question. How do we define the boundary of everything?
Because all has to have a fence around it. You can't just say all without establishing what room you're standing in.
Precisely. Let's look at how pan works inside the human body as our clinical baseline. There's a condition called panhypopituitarism.
That is a mouthful.
It is, yeah.
Mm.
The clinical origins of this trace back to a German pathologist named Morris Simmons in 1914. He was looking at pituitary failure from destroyed gland tissue.
Okay.
And later, a British physician named Harold Sheehan in 1937 described a similar massive failure induced by severe blood loss during childbirth.
So in older textbooks, you might see Simmons disease or Sheehan syndrome, but what does the pan actually tell the doctor?
It tells them the entire control board is offline.
Oh, wow.
Yeah, the pituitary is a tiny gland at the base of your brain, but it's the master gland. It has an anterior lobe that sends out distinct hormone lines to control your thyroid, your adrenal glands, your reproductive system, your growth.
It does a lot.
A ton. So if you have just hypopituitarism, maybe one of those lines is down. Like you're just missing thyroid stimulation.
Yeah.
But panhypopituitarism, that means every single anterior pituitary hormone line has failed simultaneously. It's absolute totality, but only within that specific boundary of the pituitary gland.
Right. Let me contrast that with how we talk about the blood, because I think this hits closer to home for anyone who has ever had routine lab work done.
Absolutely.
You look at something like anemia, which just means your red blood cells are low, or polycythemia, where you have too many red blood cells, poly meaning many.
Right.
But then you see the word pancytopenia on a chart.
Well, blood relies on 3 major cell lines produced in your bone marrow. Your red cells for oxygen, your white cells for fighting infection, and your platelets for clotting.
Right, the big 3.
Yeah. The term cytopenia alone just means a deficiency of cells. But adding pan to the front completely alters the gravity of the situation.
Because it means all of them.
Exactly. Pancytopenia means all 3 of those production lines have crashed at the exact same time.
Wait, if pan just means all, why does pancytopenia sound so much scarier than just anemia? I mean, I look at this like the difference between one burned out light bulb versus the entire house losing power.
That is a brilliant way to conceptualize it, actually.
Because if one light is out, it means you need to go buy some iron supplements. But if the whole house goes dark, you need to go check the breaker box. Or in this case, get a bone marrow biopsy.
Exactly. The pan prefix is doing heavy lifting for medical triage there. If only your red cells are down, the doctor looks for a simple leak or a nutritional gap.
Like the iron.
Right. But if all 3 lines are down, if the whole house is dark, like you said, it points toward a central system failure. The bone marrow factory itself is shut down.
Oh, man.
Yeah, maybe it's aplastic anemia, or the marrow is being infiltrated by leukemia, or it's being suppressed by a highly toxic drug. The prefix shifts the diagnosis from a symptom to a systemic collapse.
So inside the body, pan seems like a pretty rigid, useful boundary. But what happens when pan moves outside the body, like to populations?
Ah.
Because the word pandemic is unquestionably the most famous pan word we have right now.
And this is exactly where the boundary of all gets incredibly controversial. The word stops being purely scientific and becomes an epidemiological battleground.
Right.
The word pandemic, as an English borrowing, actually dates back to the 17th century from the Greek pandemos. But pandemos originally meant of all the people in the context of public assemblies and town halls, not disease.
Wait, how does a word for a town hall meeting become the scariest word in global health? Did they just repurpose it because, like, everyone was gathered together in one place and coughing on each other?
Haha, close. It entered common epidemiological use much later, during the massive cholera outbreaks of the 19th century.
Okay, so a few hundred years later.
Yeah. With the rise of steamships and global trade, physicians were suddenly watching diseases move faster than ever before.
Yeah.
They needed a specific word to categorize outbreaks that had crossed the boundary from regional contained events to intercontinental threats.
So the public assembly became the whole globe.
It-
It's an escalation ladder. You have sporadic cases. Then you move up to endemic, which just means a constant expected baseline of a disease in a specific population.
Like the common cold.
Right. Then you get an epidemic, which is a sudden regional spike.
Yeah.
And at the very top, pandemic, which is multi-continent spread.
But here's the critical misconception we really need to clear up, because our sources highlight this as a massive blind spot for the public.
Let's hear it.
A pandemic is almost entirely about geographic spread. It is not inherently about lethality.
Wow.
The boundary of all is defined by regions on a map, not the mortality rate of the people inside them.
This completely blew my mind when I was reading the notes. The prefix is about scope, not severity.
Exactly. Think about Ebola. You can have a localized Ebola outbreak that is exceptionally lethal with a terrifying case fatality rate.
Right. Very scared.
But it remains classified as an epidemic because it hasn't achieved sustained transmission across multiple continents. It's deadly, but it's not pan.
And this exact distinction, geography over severity, led to a massive controversy with the World Health Organization, didn't it?
It did. And it is vital to look at this impartially because it perfectly illustrates how these mathematical-sounding prefixes are actually negotiated by committees.
Which is just crazy to think about.
It is. So for years before 2009, the WHO's working definition of an influenza pandemic explicitly required enormous numbers of deaths and illness. There was a severity clause baked into the word.
Okay, so it had to be deadly and widespread.
Right. But in 2009, right ahead of the H1N1 swine flu outbreak, the WHO quietly dropped that severity clause from their guidelines. Suddenly, pandemic became purely a statement about geographic spread.
I mean, I have to ask on behalf of everyone listening, why would they drop the severity clause? Doesn't decoupling the word from the death toll just invite global panic for a mild virus?
The public health rationale is actually quite logical when you dig into it. Early in an outbreak, severity is incredibly difficult to measure.
Okay, how so?
Well, if you only test the sickest patients who show up at the hospital, your mortality rate looks terrifyingly high, while thousands of mild cases go uncounted.
Oh, that makes sense.
Yeah. So if the WHO waits for an undeniable, enormous body count to declare a pandemic, they delay triggering international funding, mobilizing resources, and starting vaccine production.
So they're just trying to be proactive.
They argued they needed to move fast based on how far the virus was traveling, not wait around to see how deadly it eventually proved to be.
But people definitely noticed the change, and the blowback was intense.
Tremendous blowback. Critics, including a major 2010 investigation by the Parliamentary Assembly of the Council of Europe, argued this definitional shift allowed the WHO to declare a pandemic for a virus that turned out to be comparatively mild.
Yeah, I remember that.
And they pointed to a potential conflict of interest. Many governments had pre-purchase contracts for vaccines with major pharmaceutical companies.
Oh, boy.
But those lucrative contracts would only be triggered if the WHO officially declared a pandemic.
Okay, just to be incredibly clear for you listening, we're not taking a side on the WHO's motives here. The WHO firmly and consistently denied that the definitional change was improperly motivated by industry ties, maintaining it was strictly a public health maneuver.
Absolutely.
But the takeaway here is that this is a textbook case of a prefix's plain meaning being redefined by a committee in real time. resulting in massive financial, political, and psychological consequences.
Exactly. And if you want to see how impossible this is to get this right, contrast that 2009 controversy with March 11th, 2020.
Right, COVID.
Yeah. WHO Director General Tedros formally characterized COVID-19 as a pandemic. But this was weeks after the virus had already spread to dozens of countries and caused massive lockdowns.
So in 2009, they were heavily criticized for being too fast and triggering spending for a mild virus. And in 2020, they were heavily criticized for being too slow to use the P word when people were actually dying.
It highlights how heavily politicized the all-in pan really is. The boundary's always moving.
Yeah. And this matters for you, the listener, right now. When you read news headlines about Mpox, which the WHO declared a public health emergency in 2022 and again in 2024, or you read about H5N1 avian influenza spreading in dairy cattle, understanding this prefix is your armor.
That's a great way to put it.
It's why you don't need to instantly panic or entirely underreact just based on a label. The prefix tells you how far it traveled, not how hard it hits.
And before we transition away from pan, we should note it even causes heated debates in the operating room. Take the surgical term panhysterectomy.
No, wait. Based on what we just learned about totality, wouldn't that just mean removing absolutely everything in the reproductive tract?
You would certainly think so. But surgeons inconsistently debate its meaning depending on where and when they trained.
Seriously?
Yeah. Some use it to mean the removal of the uterus, the cervix, both fallopian tubes, and both ovaries. In official medical coding, that is called a total hysterectomy with bilateral salpingo-oophorectomy.
Wow, okay. Salpingo referring to the tubes, oof to the ovaries, right?
Correct.
Which is a massive mouthful, so I see why they want a shortcut.
Yes, but other surgeons use total hysterectomy to mean just the uterus and cervix are gone, and they throw the pan prefix around really loosely to imply other structures might have been taken.
That seems dangerous.
It is, because panhysterectomy is a casual shorthand and not a rigidly standardized coding term. It creates dangerous ambiguity in a patient's chart about what was actually removed. It proves that even when medicine promises totality, human habit makes it sloppy.
Man. So the WHO's definition of pan triggered global economic shockwaves based on a geographic boundary, and surgical habits make pan sloppy in the OR. That's the macro scale.
Right.
But what happens when a single prefix dictates whether a surgeon removes your entire breast or just a tiny lump? Let's zoom into the microscopic scale with our second prefix, neo.
This is a crucial pivot. Neo comes from the Greek neos, meaning new. It signals novelty, recency, or an altered version of something that already exists.
Okay.
To really decode the power of this prefix, we have to look at the word neoplasm.
Which is a word that instantly spikes a patient's blood pressure. I mean, if you're reading a biopsy report and you see neoplasm, you think the absolute worst. You assume it means cancer.
It is heavily stigmatized, yes. But let's demystify it by looking at the history. The term rose to prominence in the mid-19th century alongside the birth of cellular pathology.
Before that, they didn't really know what tumors were.
Exactly. Before this, doctors didn't really understand how tumors formed. But in 1858, Rudolf Virchow introduced a famous doctrine, omnis cellula e cellula. Every cell stems from another cell.
Meaning things don't just spontaneously appear out of thin air.
Right. This gave pathologists a framework to distinguish normal, healthy cell division from cells that had basically gone rogue and decided to build their own structure without the body's permission.
Wow.
That autonomous rogue tissue is exactly what neoplasm, literally new formation, was coined to describe.
So the translation is just new growth. It is a totally neutral statement of fact.
A major misconception we have to correct is that neoplasm equals cancer. It does not.
Really?
Really. Think of a lipoma, which is a very common, squishy, fatty tumor under the skin. A lipoma is a neoplasm because it is a new tissue formation that shouldn't be there.
Okay, right.
But it is entirely benign. It won't spread. Only malignant neoplasms are cancer. Using neoplasm colloquially as a guaranteed death sentence is a failure to understand the prefix. It just means new.
Here's where it gets really interesting, though, because neo doesn't just describe a clump of cells. In oncology, adding neo to a word can literally reverse time.
This is arguably one of the most powerful uses of a prefix in all of modern medicine. The critical difference between adjuvant therapy and neoadjuvant therapy.
So let's break that down. Adjuvant therapy is extra treatment like chemotherapy, radiation, or hormone pills given after the primary surgery.
Exactly.
The surgeon goes in, takes out the main tumor, and then the adjuvant therapy acts like a sweep team, mopping up any microscopic rogue cells left behind.
But add neo to the front. Neoadjuvant therapy is that exact same systemic treatment given before the primary surgery.
Before.
Yes. The goal is to aggressively shrink the tumor first. That simple three-letter prefix turns the concept of after into before plus after. And that shift completely alters the physical landscape for the surgeon.
The sources cite this incredible landmark trial from the 1990s, the NSABP B18 breast cancer trial. And the human stakes of this are massive.
The National Surgical Adjuvant Breast and Bowel Project, they ran a massive trial to see what happens if you just flip the sequence.
It's just changing the timeline?
Yeah. They found that giving chemotherapy neoadjuvantly sending the drugs into the battlefront before the surgeon ever picked up a scalpel-yielded equivalent long-term survival rates to giving the drugs after.
Okay, so the survival is the same.
But mechanically, it changed everything.
Because the drugs shrink the battlefield.
Exactly. Imagine a tumor the size of a golf ball shrinking down to the size of a pea before surgery day. Because the tumor shrank so dramatically, it allowed for significantly more breast-conserving surgeries.
That's huge.
Thousands of patients could safely have localized lumpectomies instead of full traumatic mastectomies.
That is profound. One three-letter prefix changes whether a woman keeps her breast. Confusing neoadjuvant and adjuvant in a treatment plan isn't just a typo for medical billing. It is a massive sequencing error that alters a human life.
Time is the defining factor for neo. You see this most intuitively in birth timelines, which is a great way to anchor this concept in everyday life.
Oh, right, like neonatal intensive care unit.
Yes. Neo means newest. So the neonatal window is strictly the newborn period, usually the first 28 days of life.
Okay.
But compare that to perinatal. Peri means around. Perinatal is the broader window around birth, spanning roughly 20 to 22 weeks of gestation all the way through the first few weeks after birth.
It was a bigger window.
Much bigger. And then postnatal is generally anything after birth. There are 3 overlapping time windows, and a pediatrician's entire treatment protocol hinges on the precise meaning of whichever prefix they are looking at.
Okay, so we've seen prefixes that shift global health policies, and ones that literally reverse surgical timelines. But what happens when a prefix is entirely subjective?
Yeah, this gets tricky.
Let's talk about our third source focus, semi, the Latin prefix for half or partial.
Semi is a fascinating trap because it's contested in a much quieter, more clinical way than pan. It signals partiality. Not fully, not completely, somewhere stuck in between.
Right.
But the danger is that there are 2 totally distinct ways it gets used in medicine, descriptively and subjectively.
Let's start with the descriptive use, because that one actually makes sense geometrically.
Think of the semilunar valves in your heart, the aortic and pulmonary valves that pump blood out. They are called semilunar because each of their little leaflets is shaped perfectly like a half moon. Semi plus luna.
Like a crescent.
Exactly. This distinguishes them from the other valves in your heart, the mitral and tricuspid valves, which are built entirely differently with flap-like cusps tethered by parachute cords.
So calling it a semilunar valve just describes the architectural shape. It does not mean the valve is only half-functioning or broken.
Correct. It's a geometric descriptive use. It is safe. But then we cross over into this subjective use of degree. Words you hear all the time in emergency rooms, like semi-conscious or semi-comatose.
And this is where the wheels completely fall off the precision wagon.
They really do.
Because if I say a patient is semi-conscious, isn't that like saying someone is semi-tall or semi-funny? It means absolutely nothing without a measuring stick. How do you measure half of consciousness?
You can't. And that is exactly the problem with the prefix here. These are incredibly common bedside words, but neither has a standardized, universal operational definition.
So it's just guessing.
Basically, 2 exhausted nurses can look at the exact same patient at 3 a.m. and call them semi-conscious while meaning entirely different things. One might mean the patient mumbles when you say their name. Another might mean the patient only groans if you apply deep physical pain.
Man, if you're ever looking at an older relative's medical chart and see a subjective word like semi-conscious, you should immediately be asking the doctor, what does that actually mean for them? What scale are you using?
Which is exactly why modern critical care documentation is actively trying to banish the prefix semi for consciousness altogether. It's too dangerous.
So what do they use instead?
They favor objective numeric scales, like the AVPU scale.
AVPU.
Right. ADPU forces the clinician to stop guessing and actually check. Is the patient alert? Do they respond to voice? Do they respond to pain? Or are they entirely unresponsive?
Oh, that makes so much more sense.
Or they use the Glasgow Coma Scale, saying a patient is GCS 8. You need a standard undeniable threshold, and semi just doesn't provide one.
Now, for anyone trying to master this vocabulary, the sources highlight a massive trap here, a Greek twin that loves to impersonate our Latin friend semi.
Ah, yes. Hemi. This is a classic medical exam misconception that trips people up constantly. Hemi is Greek, and it is the strict, rigid choice in anatomy and neurology for a literal bilateral anatomical half.
We're talking about words like hemiplegia, which is paralysis on exactly one side of the body, left or right, or the hemispheres of the brain. Or heminopia, which is a fascinating condition where you literally lose half of your visual field.
The rule of thumb here is crucial. Hemi describes an actual physical bisection, left from right, top from bottom.
Right.
Semi describes a partial degree or a crescent shape. You cannot swap them. A semisphere is nonsense. It just isn't standard medical vocabulary.
It's funny how they mean the exact same thing etymologically, but they have completely different jobs on a patient's chart. And, if you really want to talk about partiality versus having absolutely nothing at all, we have to briefly mention the prefix a or an.
Oh, absolutely. Adding a or an to a word means total absence, a void, like apyrexia, meaning a patient is entirely without fever.
Like asymptomatic.
Exactly. It's the perfect logical contrast to pan. Apyrexia is the total absence of something, while panhypopituitarism is the loss of absolutely everything in a system.
They're total opposites.
Yes, students often blur these logical operations, but they sit on opposite ends of the diagnostic spectrum.
So, what does this all mean? We've looked at the boundaries of all, the shifting timelines of new, and the dangerous subjectivity of half. How did we end up with this patchwork system?
Well, if we connect this to the bigger historical picture, the core underlying truth is that we've been bolting these ancient Greek and Latin roots together for thousands of years.
How long then?
It goes all the way back to the Hippocratic corpus in ancient Greece and through Galen in Rome. Because those were the shared scholarly languages of Western medicine, doctors just kept stacking prefixes on top of root words.
But nobody was actually standardizing it back then. A doctor in London and a doctor in Vienna might use the exact same Greek prefix to mean two totally different things.
Exactly. Anatomists spent centuries using inconsistent, wildly competing names for the same body parts. It wasn't until the end of the 19th century that this became completely untenable.
What changed?
The invention of the telegraph, mostly, and the rise of international medical conferences meant doctors from all over the world were suddenly trying to read each other's research. In 1895, they held a massive conference to create the Basel Nomina Anatomica.
The first internationally agreed anatomical vocabulary.
Right. They just sit in committees and literally vote on what these ancient prefixes would legally mean in a modern hospital.
Which eventually evolved into today's Terminologia Anatomica in 1998. So the rule book that dictates these words is shockingly modern, even though the words themselves are ancient.
Which is why they feel so human. They are the result of committee compromises, not divine mathematical equations.
Okay, let's bring this all home. Here are the big takeaways from these sources for you to keep in your back pocket the next time you're reading a health headline or your own chart.
Let's do it.
When you see neo, take a breath. It just means new or abnormal tissue. It does not automatically mean a malignant cancer.
Right.
When you hear about a pandemic, remember it describes the geographic map of the virus, not necessarily how deadly it is.
It's very important.
Semi is a dangerous word for partial that doctors are trying to replace with real numbers, whereas its Greek twin hemi means a literal physical half.
Exactly.
And above all, sequencing matters. A neoadjuvant prefix can literally shrink a tear before a surgeon ever touches it.
Knowledge really is most valuable when it's understood and applied. When you realize that human judgment creates the boundary for all or new or half, you read the medical news with a much sharper, more critical eye.
Absolutely.
You stop being intimidated by the Latin.
Which brings us right back to where we started. That feeling of staring at a medical chart, expecting binary perfection, expecting the language of your own body to be as clean and indisputable as that jagged white line on a broken bone.
It's a nice thought.
But as we've seen, it's actually incredibly muddy. It's negotiated, and that raises a final important question for you to mull over on your own today.
Okay.
We are rapidly moving into a new era of hyper-precise AI diagnostics and molecular tracking.
We are indeed.
If a machine learning model can look at a scan and give us the exact cellular percentage of a tumor, or track the exact geographic spread of a virus in real time down to the city block, will broad, committee-defined terms like neo and pan eventually become obsolete.
That's a fascinating thought.
Will they become relics of a less precise age? Or is human judgment the messy ability to draw a boundary line and say, this is enough, something we will always need in medicine?
I guess we'll find out.
We'll leave you to ponder how the language of your health will evolve next.